Hi, I'm Gary. I'm from Allston, which is a neighborhood within Boston. I live on Cape Cod now with my wife and 2 children. I've taught in the classroom for 23 years. I'm actually now an assistant principal for the last 4 years. I'm familiar with cancer in an intimate way. My brother passed away from colon cancer in his early 40s in 2008. I'm diagnosed with PV, polycythemia vera. I've been diagnosed since January of 2021. I'm hoping by sharing my story, I can inspire people to live a full life and to let them know that there's a positive path forward with the right treatment and the right doctor. So what led me to being diagnosed with PV was for years when I was hiking, and I'm an avid hiker, when I was going down the mountain, my feet would sometimes burn and itch. So I went to my primary care physician, and she referred me to a podiatrist. The podiatrist prescribed insoles and told me that I needed to stretch my calves more, but the burning and the itching wouldn't go away. So in December of 2020, I went back to my primary care physician. She ordered up blood tests and found that I had a JAK2 mutation, but it wasn't anything to worry about now. So I went home and I told my wife Jess this, and she didn't like the watch and wait approach. So she started researching doctors and MPN specialists, and that's how we found one in Boston. In January of 2021, she had ordered up more blood tests. She ordered a bone biopsy. So that confirmed the JAK2 mutation. I was making too many red blood cells and too many platelets. When my MPN specialist told me that I had cancer, again, I heard every other word. My outlook certainly dipped at that time. I was angry. I was always healthy. I wasn't taking any medicine for anything. I needed to get out. I needed to go hike. So that winter I hiked all winter long to deal with it, to try to absorb what I was going through. Cancer is a powerful word. It carries a lot of weight, and I didn't want to give it that power. So I had to forge a plan and forge a path forward for myself, for my family. My MPN specialist showed me that there was a way forward, a path forward. I could be proactive. I could take steps to mitigate PV. Having PV is like dealing with a wildfire, and my goal was to contain the wildfire. My treatment was to start phlebotomy, which I absolutely hated the whole experience of phlebotomy. I've never been a fan of needles. That one incident in particular, they ended up sticking me 5 times, but it wasn't helping. My blood counts were not coming down. So my doctor talked to me about interferons and the fact that interferons act at the source of the disease within the bone marrow. She talked to me about BESREMi. She talked to me about I can't even pronounce the name of that medicine, but it's a chemo medicine. I asked my doctor what she would do, and she said I would go with the BESREMi. And again, I trusted her implicitly, so I went with the BESREMi.
Important safety information. What is the most important information I should know about BESREMi? BESREMi can cause serious side effects that may cause death or may worsen certain serious diseases that you may already have. Tell your healthcare provider right away if you have any serious side effects during treatment with BESREMi. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking BESREMi. These symptoms may go away in some people after they stop taking BESREMi.
I was nervous because I still didn't like needles. But when I saw the needle, it's very, very small, and I was trained. The doctor offered training. So the first time I did it with a nurse, and she walked me through the steps. Now, when I first started, I didn't have symptoms at 150 micrograms. But as I got up to 250, I started to feel a little lethargic, a little like I was coming down with the cold. But for me, it would only last 24 hours, maybe less. By September, my numbers were near normal. Now, I didn't realize how concerned my wife Jess was until she saw those numbers were normal. She had tears of joy. I was relieved. And as we went through the fall, they were still doing my blood counts every few months, and the counts were better and better until March of 2023, the numbers were normal. That's been my experience with BESREMi. My outlook on life now is certainly changed, and again, it's optimism and hope have always been disciplines that I try to adhere to, but I see life as more precious. I try to savor the moments with family and friends. That's the goal.
Important safety information continued. What is the most important information I should know about BESREMi? Continued. Mental health problems, including suicide. BESREMi may cause you to develop mood or behavior problems that may get worse during treatment with BESREMi or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, feeling bad about yourself or feeling hopeless, unusually grand ideas, acting aggressive, acting impulsively, or thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, you, your caregiver, or family member should call your healthcare provider immediately. Your healthcare provider should carefully monitor you during treatment with BESREMi. New or worsening autoimmune problems. BESREMi may cause autoimmune problems, a condition where the body's immune cells attack other cells or organs in the body, including thyroid problems, increased blood sugar, hyperglycemia, and type 1 diabetes. In some people who already have an autoimmune problem, it may get worse during your treatment with BESREMi. Tell your healthcare provider if you have tiredness, are urinating often, or if you are very thirsty. Heart problems. BESREMi may cause heart problems, including problems with your heart muscle, cardiomyopathy, heart attack, abnormal heart rhythm, atrial fibrillation, and decreased blood flow to your heart. You should not use BESREMi if you have high blood pressure that is not controlled, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, or a recent stroke or heart attack. If you have a heart problem before you start using BESREMi, your healthcare provider should monitor you closely during treatment with BESREMi. Who should not use BESREMi? Do not use BESREMi if you have or had severe mental health problems, especially severe depression, thoughts of suicide, or attempted suicide. Have or had a serious or untreated autoimmune disease. Have had a serious allergic reaction to another interferon product or to any of the ingredients in BESREMi. Symptoms of a serious allergic reaction may include itching, swelling of your face, tongue, throat, trouble breathing, feeling dizzy or faint, and chest pain. Have certain types of liver problems. Have received a transplant and take immunosuppressive medicines. Before using BESREMi, tell your healthcare provider about all of your medical conditions, including if you are being treated for a mental illness or had treatment in the past for any mental illness, including depression, and have had thoughts of hurting yourself or others. Have type 1 diabetes. Have or ever had any problems with your heart, including heart attack or high blood pressure. Have or ever had bleeding problems, a blood clot, or low blood cell counts. Have a condition that suppresses your immune system, such as certain cancers. Have hepatitis B or HIV infection. Have kidney or liver problems. Are pregnant or plan to become pregnant. BESREMi may harm your unborn baby and may cause loss of your pregnancy, miscarriage. Before you start using BESREMi, your healthcare provider should do a pregnancy test. You should use effective birth control during treatment and for at least 8 weeks after your final dose of BESREMi. Talk to your healthcare provider about birth control choices for you during treatment with BESREMi. BESREMi can affect your menstrual cycles and may cause your menstrual periods to stop. Tell your healthcare provider if you become pregnant during treatment with BESREMi. are breastfeeding or plan to breastfeed. It is not known if BESREMi passes into your breast milk. You should not breastfeed during treatment and for 8 weeks after your final dose of BESREMi. What are the possible side effects of BESREMi? BESREMi can cause serious side effects including decreased blood cell counts. Your healthcare provider should check your blood cell counts before you start and during treatment with BESREMi. If your blood cell counts are too low, you can develop anemia, infections, or have problems with bleeding or bruising. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nose bleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions and skin reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue, or throat, trouble breathing, chest pain, or feeling faint. Eye problems. BESREMi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with BESREMi if you have diabetes or high blood pressure and also have retinal problems. Your healthcare provider may stop BESREMi if you develop new or worse eye problems during treatment with BESREMi. Liver problems. BESREMi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with BESREMi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with BESREMi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, blood in your urine, swelling in your ankles, or loss of appetite. Your healthcare provider may stop BESREMi if you develop severe kidney problems. Tooth and gum periodontal problems. BESREMi can cause tooth and gum problems, which can lead to tooth loss. BESREMi can also cause problems with dry mouth that can damage your teeth and the lining of the mouth during long-term treatment with BESREMi. It is important for you to brush your teeth well 2 times each day and have regular dental examinations during treatment with BESREMi. Skin problems. BESREMi can cause skin problems. Signs and symptoms of a skin problem with BESREMi include itching, hair loss, rash, redness, psoriasis, acne, thickening of the skin, or excessive sweating. Call your healthcare provider if you develop a rash that is bothersome or covers a large skin area. The most common side effects of BESREMi include flu-like symptoms including tiredness, weakness, fever, chills, muscle aches, and joint pain, itching, sore throat. What is BESREMi? BESREMi is a prescription medicine that is used to treat adults with polycythemia vera. Please see full prescribing information, including boxed warning and medication guide for BESREMi.